Welcome to Copilot Podcasts. In 2016, over 250,000 people died from preventable medical errors in the United States alone. Today, we're exploring how artificial intelligence is transforming orthopedic surgery, potentially saving thousands of lives, and what this means for the future of medicine.
Those numbers are staggering, and they really underscore why we need better tools in medicine.
And AI seems to be that tool. I mean, the accuracy rates I'm seeing in the research are mind-blowing. Can you break down what's happening in this field?
Well, let's start with diagnosis. Recent studies show AI algorithms can detect fractures with up to 98% accuracy. That's matching or even surpassing human specialists.
Wait, 98%? That's incredible.
It is. And for specific conditions like hip fractures, we're seeing 97.1% sensitivity and 96.7% specificity in binary classification.
Could you break down what that means for our listeners?
Sure. Think of it this way. Out of 100 hip fractures, the AI would correctly identify 97 of them, and out of 100 normal hips, it would correctly identify 96 as normal.
You know, this reminds me of how computer navigation systems evolved in the early 2000s. Started small and then just exploded in capability.
Exactly. And just like those early navigation systems, AI is now becoming essential in preoperative planning.
How exactly does that work?
AI creates incredibly detailed 3D anatomical models and helps surgeons plan the most precise approach. It's actually improved surgical precision by 45%.
That's a huge improvement. But what happens during the actual surgery?
That's where AI-powered robotic systems like Mako and ROSA come in. They provide real-time guidance and can even give tactile feedback to the surgeon.
Tactile feedback? Like they can actually feel what they're doing?
Exactly. And you know what's interesting? A lot of this technology actually has roots in gaming.
No way. Like video games?
Yes, the same principles that make virtual reality gaming immersive are being used to train surgeons in a risk-free environment.
That's fascinating. But let's talk about after surgery. How does AI help there?
This is where it gets really interesting. We now have AI-powered smart implant sensors that can monitor healing in real time.
Smart implants? Like the actual replacement joints have sensors?
Exactly. They can detect early complications and help create personalized rehabilitation plans.
That's incredible. But surely there must be some challenges with all this technology?
Oh, absolutely. Data quality and algorithmic bias are major concerns. We need to ensure these systems work equally well for all patient populations.
Can you elaborate on that?
Well, if an AI system is trained primarily on data from one demographic group, it might not perform as well for others. This is a serious ethical consideration.
That's a really important point. What other challenges are there?
Cost is a big one. These systems are expensive, and there's also resistance from surgeons who prefer their traditional methods.
I can imagine that's a tough barrier to overcome.
It is, but here's something counterintuitive. AI actually makes surgery more human-centered, not less.
How so?
By handling the technical precision aspects, AI frees surgeons to focus more on the patient's individual needs and circumstances.
That's fascinating. It's like AI enhances the human element rather than replacing it.
Exactly. And research shows this combination of human expertise and AI assistance leads to better outcomes.
Speaking of outcomes, what kind of improvements are we seeing?
Studies show decreased revision rates, better alignment in joint replacements, and shorter recovery times.
And this is all documented in clinical studies?
Yes, multiple studies have validated these improvements. The evidence is quite robust.
What about the learning curve for surgeons? How do they adapt to these new technologies?
That's where AI-powered virtual reality training comes in. It allows surgeons to practice procedures repeatedly in a safe environment.
Almost like a flight simulator for surgeons?
Exactly. And they can practice rare or complex cases that they might not see often in real life.
That's incredible. What about the future? Where is this all heading?
We're moving toward more integrated systems that combine imaging, planning, and execution all in one platform.
Can you give an example?
Imagine a system that can analyze a patient's imaging, create a 3D surgical plan, guide the procedure, and then monitor recovery, all while learning and improving from each case.
That sounds almost like science fiction.
But it's becoming reality. The technology is developing at an incredible pace.
What about privacy concerns with all this data collection?
That's a crucial issue. We need robust frameworks for data protection and patient consent.
Are there any solutions in development?
Yes, researchers are working on privacy-preserving AI models that can learn without accessing sensitive patient information directly.
That's reassuring. What excites you most about the future of AI in orthopedics?
The potential for truly personalized medicine. Every patient is unique, and AI can help us tailor treatments more precisely than ever before.
And reduce those medical errors we talked about at the beginning?
Exactly. That's the ultimate goal. Safer, more precise, and more effective treatments for every patient.
What would you say to surgeons who are skeptical about adopting AI?
I'd remind them that AI isn't replacing surgical judgment, it's enhancing it. It's like having a highly intelligent assistant.
That's a great way to look at it.
And the evidence is clear: when surgeons embrace these tools, patients benefit.
Let's wrap up. What's the key takeaway for our listeners?
AI in orthopedics isn't just about fancy technology, it's about saving lives and improving outcomes for millions of patients.
And reducing those 250,000 preventable deaths we mentioned at the start.
Exactly. Every improvement in accuracy and precision means more patients going home healthy.
Well, that brings us to the end of today's episode of Copilot Podcasts. Remember, the next time you hear about AI in surgery, it's not about replacing doctors. It's about giving them superpowers to help us all live healthier lives.
And those superpowers are getting stronger every day.
Thanks for joining us on this fascinating journey into the future of orthopedic surgery. Until next time.